ಎಲ್ಲಿ ನನ್ನ ಲ್ಯಾಪ್ಟಾಪ್ ಅಲ್ಲ ವಿಂಡೋಸ್ ಎ ಹೌದು ಪೀನಾ ವಿಂಡೋಸ್ ಎ ಮಾಡಿದ್ರೆ ಇದು ಬಂತು ಸರ್ ವಿಂಡೋಸ್ ಪೀನಾ ಸರಿ ಇದಕ್ಕೆ ಕನೆಕ್ಟ್ ಮಾಡಿಬಿಟ್ರೆ ನನ್ನ ಮೌಸು ಕೆಲಸ ಮಾಡ್ತಾಯಿಲ್ಲ ವಿಂಡೋಸ್ ಪೀನಾ ಏನೋ ಬಂತು ಪಿ ಸಿ ಸ್ಕ್ರೀನ್ ಡೂಪ್ಲಿಕೇಟ್ ಎಕ್ಸ್ಟೆಂಡ್ ಡೂಪ್ಲಿಕೇಟ್ ಕಂಪ್ಯೂಟರ್ ನೋ ಸಿಗ್ನಲ್ ಅಂತ ಬರ್ತದೆ ಬಂತು ಎಸ್ ಓಕೆ ಥ್ಯಾಂಕ್ ಯು ಸರ್ ಥ್ಯಾಂಕ್ ಯು Okay students, good afternoon. Welcome to the practical instruction class of biochemistry. Okay, so we are going to start with analysis of abnormal constituents of urine. Okay, so analysis of abnormal constituents of urine. So quick recap of what are the normal constituents of urine. Okay, so if you have to know what are the abnormal constituents, first you need to know the normal constituents. So we have finished the normal urine analysis class maybe 1 or 2 months back. So we'll just have a quick recap. So what are the normal constituents of urine? Organic, inorganic constituents, right? So what are the organic constituents? All this urea, creatinine, uric acid, they are the organic constituents. Inorganic constituents are sodium, chloride, all those things. So you know we have done those various tests for sodium, chloride, sulfate, ammonia, phosphorus, all that we have done. So now we are going to do analysis of abnormal constituents of urine. So why is this very important? So doesn't mean that every test that comes to you for analysis is normal. Definitely there will be abnormal constituents in the urine also. So you need to know what you should search for. So when you see the sample of urine, when you do the physical examination, even in normal urine you had physical examination and physical properties and chemical properties. So similarly here also you will be having physical properties and chemical properties. So what are the physical properties? Quick recap. Normal urine, you will see color, odor, volume, pH, specific gravity, total solids. So under these headings you would identify and write down your findings, isn't it? So here in abnormal urine also you will have the similar same side headings under which you will have to examine, but only thing it will be abnormal variant. So now we'll come and we'll have a look at what are the abnormal constituents that can be present in urine. So please refer to page number 27 in the manual that I have sent you. We'll just shift there. So here you can see. So how do we preserve the urine? Preservation of urine already has been taught to you. So you use chloroform, toluene or chloroform. Sometimes physicians ask for 24 hours urine sample, urine specimen. So you have to give the instructions carefully to the patient and tell him to collect it in this specific can which already has preservatives, so that there is no other changes undergo, no other chemical reactions undergo, and you have to inhibit the bacteria that might grow and give wrong analysis. Okay, so this is how you're going to preserve the urine using toluene or chloroform. All the preservation part, all the collection part we have already discussed when we are doing normal analysis. So now we will start with physical properties. Okay, so first, as I already told you, you have to check the appearance. So appearance, normal urine, what did you see? You looked for, yes, you looked for clarity, clearance, how it was looking, whether it was clear or whether it was turbid. So normal urine will definitely be normal and will not have any suspension. So abnormal urine will have turbidity or cloudy appearance due to the presence of urates like ammonium urate in the alkaline urine and metal urate in acidic urine. So if the urine is alkaline, you will have ammonium urate, and if the urine is acidic, sometimes you will have metal urates. And they also have turbidity due to phosphates. Turbidity due to phosphates. So calcium phosphate is the most commonly present phosphate in urine. So you remember when we were doing a heat coagulation test, you would heat the upper 1/3 of the urine of the test tube. For urine, when you did the heat coagulation test, you used to heat the upper 1/3 of the test tube and then add acetic acid to dissolve the phosphates so that false positive test does not come. Okay, so you are dissolving the phosphates which are usually present in the urine. So it is for this reason that urine is acidified while conducting the heat coagulation test. Now, so the turbidity or the cloudy appearance that I am talking about, what are the causes for this? So it could be fat globules present in lipiduria and chyluria. Okay, lipiduria is excess lipid or fats globules in the urine, or chyluria means lymph. Okay, lymph will spill over due to various reasons, could be cancer, anything. Okay, or it could be a fistula, anything that is draining into the urine or urinary bladder. So then you will have chyluria. Patient may have chyluria. Then there could also be RBCs, that is blood, WBCs, pus cells and microorganisms. So all these are the causes for turbidity. If your urine is turbid, if the sample that you received is turbid. So when you hold the sample up in the air and keep a sheet of paper behind it, you can see whether it is turbid or whether it is clear. So normal urine you have seen is very clear. Turbidity will be like cloudy appearance. Okay, in between it will not be very transparent as the normal urine. Second, then you see for color. So what is the normal color of the regular normal urine? Straw color, straw or amber yellow color is what we say. So but an abnormal urine will have multiple, there are so many colors which can be the cause as shown here. So the first one that we would consider is almost colorless, that is, it is almost like water. So when can you see this? So you can see this in a condition called diabetes insipidus. This is due to dilution of the urine. So what happens in diabetes insipidus? Antidiuretic hormone. Okay, so there is problem due to antidiuretic hormone. So lots of urine is produced. So when lots of urine is there, the solvents get diluted. So it appears almost colorless. That is one of the cause. Also another cause, physiological cause could be due to excess water intake. Okay, excess water intake. Also, if you are frequently drinking a lot of water, if you are exercising and if it is very hot, sometimes if you are exercising also and gulping lots of water, you will have almost colorless urine. So it could be normal and it could be abnormal also. Depends on the situation, you have to analyze. Okay, then there is the next color, dark yellow. Dark yellow is due to concentrated urine. Okay, concentrated urine due to febrile conditions and dehydration. So when does it happen? Usually in fever there is dark yellow because patient is sick, not eating, not drinking, so not drinking enough water. So the urine that is passed out is concentrated and it will be dark yellow. Plus in dehydration, summer also what will happen? So you will be excessively working, very hot, and so there will be a lot of dehydration, and then there is so much of sweating also. So there is less content of solvents, there is less content of water in the urine, so it will get concentrated and come out as dark yellow. Then there could be reddish color. Reddish color, mainly first important cause that you should suspect is blood, almost always blood. Hemoglobin and porphyrins, okay, will be the cause of reddish urine. This is seen in conditions like trauma. So whenever a patient comes with history of trauma, say I met with an accident or I had a fall or something bumped into me, my friends usually when they are playing, they hit into the stomach, what is that, they play and have fun, and they suddenly complain of reddish urine. Suddenly they'll complain of reddish urine. So then you should ask if you had any problems, if you've fallen down, if you had any punch in the stomach, or if you had blunt injury abdomen, what we call as blunt injury abdomen. In such cases, there will be reddish discoloration of the urine. And another most important cause for reddish urine is infection, UTI, urinary tract infection, and calculi. Very, very common. Calculi. Patient comes with pain while micturating and red color urine. So most of the times, 99% it is calculi. That is, calculi is stones anywhere in the renal excretory system, okay, kidney system, anywhere stones are present, either in the renal pelvis, urethra, urinary bladder, ureters. So as the stone passes down, sometimes it can just cut through the mucosa, and then there will be blood drops in the urine. How to estimate whether it is coming from the kidney, whether it is coming from the urethra, that is a different thing. But if you see a sample which is reddish color, most often think of first infection and second stones, calculi, okay. Then next, hemolysis. Hemolysis also can occur due to all this incompatible blood transfusion and some porphyrias. So that time all the blood will seep into the urine. Then you can have brownish black color. Brownish black color urine is due to homogentisic acid, which is seen in alkaptonuria, which is a inborn error of metabolism. So when we have done protein metabolism, ma'am would have taught you about alkaptonuria. So in that, discoloration of the urine to brownish black on standing is due to homogentisic acid, which is seen in alkaptonuria. And melanin in melanotic sarcoma, and methemoglobin in methemoglobinuria. Okay. Then you can see orange color. Patient comes and says, doctor, my urine is orange in color. So what could it be? So first of all, when we are treating a patient for tuberculosis, there is a combination of 4 drugs, one among which is rifampicin. Okay, rifampicin is a drug, very, very important, which is used in the treatment of tuberculosis. So this rifampicin will change the